Okay. Hi. Hello. Assalamualaikum. Hello, everyone. And welcome to our specialty webinar from Dear Doctor series. So today's session, it will be about anesthetic training. I'm happy and proud to have Dr. Najihah from Wales to, introduce and explain training aesthetics. Obviously, introduction to their series. So currently, ICRAM is doing a weekly series to help foundation doctors and also medical students and even non-training doctors to start deciding about which career path they want to take. So ICRAM is really happy to be able to platform where we can deliver a live stream show via YouTube. If anyone now, we will start with a bit of an introduction about our speaker, and then I will let you with a presentation. And towards the end, we will have a Q&A session. If you have questions, feel free to just type it in the comment section, and I will address them in the Q&A session. So anyway, my name is Dr. Farah Roslan. I'll be moderating tonight's webinar. I'm an F2 doctor in Pilgrim, and Dr. Najihah herself is a CT2 trainee. Can you explain to us a bit about yourself, Doctor, of introduction?
Oh, yes. Hi, my name is Najihah. So in hospital, I go by Noor. I'm currently a CT2 anesthetics trainee in Northwales. So I'm currently working in Wrexham Mela Hospital in anesthetics.
All right. Okay, amazing. Short and sweet introduction. So I will now let carry on with her presentation. So we will bring up her presentation into full screen mode. I said if this is happy to run, addressed by Dr. Najihah in the Q&A session. All right.
Hi, hello everyone. So today I'm going to talk about the anesthetics application. So hello. So I will talk about what we'll talk about today is we're going to talk about the specialty itself, just to give an overview what it's like working in a specialty and the training process. And then after that, we'll go through the interview overview and some tips. And then I will answer any questions that you might have. Um, so this is basically the pathway that you will go through. You want to be an anesthetist. You have to, after you graduated from medical school, you get your provisional GMC registration. And then after you've completed your F1 and F2 year, you can either take some time out or you can apply straight away for a core training. In my case, I apply straight away for anesthetic training after F2. And then now I'm in the middle of completing my core training, and then after that you can apply for to be a registrar, and after registrar then you can get your certificate of completion of training, in which case you will be a consultant. So roughly it will take around 10 years to be a consultant here. um, so in terms of anesthetic itself, there's a lot of misconceptions about the training. So anesthetic is an uncoupled training. So basically it means that you have to reapply after you finish your core training to be a registrar. And then this link to this website is a good website because this is a anesthetic national recruitment website. So it will give you all the details and all the info on applying and the timeline. So always check this website if you are planning to apply for anesthetic. And then after you completed your core training, you will need to apply for a registrar post. And then after you completed your registrar, then obviously you will CCT and become a consultant. Currently, if you're interested in intensive care medicine, it is now a separate specialty to anesthetics. So you can do dual training for intensive care medicine, and you can apply for intensive care medicine post separately after you become a registrar. So in terms of the pathway, there's a lot of curriculum changes going on at the moment. So I don't want to say things that are wrong. So we just keep, if you're interested in applying, so just keep an eye out, because I think at the moment they are planning to change the curriculum. So the CT 3 year will be CT years will be 3 years, and then you will apply for registrar in ST4 instead of the current program where you do 2 years of CT and then start a registrar post at ST3. Um, so in terms of the working and the training itself, it is an acute specialty, so it's very busy. There's a lot of on-calls and nights. Currently, I work 1 in 8 weekday nights and 1 in 4 weekends. So what that means is that I work every weekend every month, and I have at least one set of nights every 2 months. So it is a very busy specialty. It's a very steep learning curve in the beginning, because you don't really get a lot of exposure in anesthetics as a medical student, and you haven't done it before. There's a lot of things that you will never see or encounter before when you first start. But the good thing is that you won't have any on calls for the first 3 months. So all will be supervised by a consultant. And that's I think was one of the best things about doing anesthetics, is that you get a lot of one-to-one training with the consultant when you every time throughout your training. So when you first, sorry, so when you first started, you have to do this initial assessment of competence. So basically, just a list of things that you need to do to make sure that you are ready to start your own on call, to show that you are ready to do a general anesthetic on someone. So after that, only after you have completed that, around 3 to 6 months, only then they will start putting you on the on call rota, and then you can start working on your own. Of course, because it's an uncoupled training, you have to maintain your portfolio and your CV to make sure that it's up to date and ready for the ST application that's coming up. And of course, everyone knows with training, you have to do exams. So I think it's one of I might be biased, but I think it's one of the most difficult postgraduate exams, the FRCA. You have to do 2 exams in your core training and another 2 exams in your registrar years. So it never ends. Your exams never end. So if you talk to any anesthetic trainees, they will say that exams is definitely one of the cons of the training. And I've heard of a lot of people dropping out of training because they can't pass their exams, so they either do a different training or they just stay as a staff grade. For in terms of a real life experience, and just from my own experience as an anesthetic trainee, the first 3 months really gives you a time to settle in, and I would say that if you do get to you do get a post to be a core trainee, I would say enjoy the 3 months that you get, because you will never get that ever again if you stay on the anesthetic training. So you won't get any on calls or nights. You will always be supervised in the first 3 months. And as I said before, it is a steep learning curve. You will learn a lot of new procedures. Yeah, everything will be new. So among the things that you will learn is, how to manage airway. It can be form of whether you intubate or putting an eye gel in, give drugs, learning different types of drugs, and also doing access, whether it's peripheral access or central access, and you will learn how to do it with an ultrasound. Uh, and also you will also um, use a lot of new machines and equipments that you haven't seen before. So it can be quite overwhelming actually the first 3 months if you haven't had a lot of experience in anesthetic before. And a lot of people say that the first 3 months is a bit weird because you kind of feel like a medical student because you're always supervised and the consultant is always there to teach you things. So if you're very used to being a medical SHO, so it's very different. It's a very different life. And of course, if you ever feel overwhelmed with everything that's new, the ODP and anesthetic nurses are your friends because they're usually very experienced. They always know what to do. And I feel like sometimes they can read your mind. They always like give you things before you even ask for it. So always rely on these people. So as I said before, it is a very busy specialty with the on calls and nights, but it is very rewarding. There's never a dull day at work. I think after 3 to 6 months, once you got your IAC signed off, you can work on your own. Basically, meaning that you can do general anesthetic on patients who are fit and well on uncomplicated surgery. So you can do that on your own, unsupervised. There's a lot of adrenaline rush, especially if you are resuscitating someone when you're on IT on call. And it's also satisfying because you get to give someone epidural or spinal for pain relief, especially when you're doing your obstetric blocks for the pregnant women in labor. And then your work scope also covers transfer. So if there is anyone who is on a level 2 or level 3 care, meaning that they are on some kind of organ support or intubated patient who needs transferring to tertiary center, if you are in working in DGH, you will do that quite often as an IT on call where you need to accompany intubated patient to a tertiary center. So it's a varied job day to day. So it's never dull day at work. You can never predict what kind of things you will see or do whenever you are on call. And there's a lot of equipments and machines as well in anesthetics. So if you like tech stuff and machines, and technology, I would say it's definitely a specialty for you. There's this like picture of drugs that we usually use for induction for someone. And then on the right, you can see the video laryngoscopy. So, like I said, there's a lot of technology and machine and anesthetics, and especially with the progress in technology, anesthetic itself has also progressed. So we use a lot of video laryngoscopy instead of direct laryngoscopy now to help us intubate someone. So that's the first part of my talk, which is about the specialty overview. So if you have any more questions, you can write in the comments, as Dr. Farah said before. So now we will talk about the interview itself. So like I said before, the anesthetic national recruitment website is a very useful website if you are applying to anesthetics. I would say that they are very transparent about the application process. Everything is there, the timeline is there, the marking scheme is there, everything is there. So what you have to do is just to go to the website and have a look through of all the tabs and see what they are looking for in their application process. So in terms of the interview itself, there are 3 stations. The first one is the clinical interview, and then there's a portfolio station, and then there will also be a presentation stations. Um, in terms of the interview preparation, I know there are some interview courses out there. There are also some websites that help prepare you for the interview, but I'm not sure how up to date that is, because when I last used it, it doesn't look that it's updated to the current format. And of course, you can just always ask your friendly anesthetist. Um, Anesthetists are usually very friendly people. I can say that. So if you are interested, just introduce yourself to anyone that you anesthetist that you think are friendly, and then just tell them that you are interested in applying, or that you've got an interview coming up. I'm sure they will be happy to help you as well. So now we're just gonna go through what each of the interview stations, what to expect in the interview. So the first is I guess I should say as well that you don't necessarily get the stations in this order. So basically, it's kind of like OSCE. They will give you a number, and then you will just rotate through these stations during your interview. So the first one is the clinical interview. So before you start, they will give you a clinical scenario. So it's just a short clinical vignette, maybe saying that you've been called to see a post-op patient, and then they will give you some details on the symptoms, and then you will talk through it with the two panels. So like I said before, look at the clinical interview scoring on the ANRO website, so you can look at what they are looking for during that clinical interview. But I will, excuse me, sorry, but I will say that always start with A, B, C, D, E. So that's what they always want to hear. So, and always practice your A, B, C, D, E. Make sure that you look really sleek when you say that. Start with saying that, oh, I'll assess the patient airway, make sure it's patent, breathing, you will listen to the chest, the sets and everything. So practice that A, B, C, D, E until that you can get it down to 60 seconds in a very slick manner, so that you get your marks, and then you can move on from it, and they can ask you more other questions. And then the interviewers will ask you questions regarding that clinical vignette, for example, diagnosis. I think at the moment I think since the last few years, they have now moved towards more like soft skills, team working, and being safe in the clinical interview, rather than focusing on the clinical aspects of the vignette. So I think the questions that they asked me during this clinical interview is more like, oh, what makes a good cardiac arrest team? So there's not a lot of clinical questions that they don't expect you to go into details, basically in this for the clinical interview aspect. And always be safe, ask for help, escalate early, rely on other team members. They really like it if you say about working with other healthcare professionals, ask for help, like physios, surgeons, or medics, or radiologists. So yeah, they're really big on that team working at the moment. And then the next station is the portfolio station. So they will go through your portfolio, and this is when they check your self-assessment score. So make sure that you know everything by heart. So make sure whenever they ask you that, oh, where is this evidence for this, you know where it is. So you won't lose time, and you won't lose mark, because we need to get through the score so they can move on and ask you questions. There's also marks for organization of your portfolio. So make sure that your portfolio is organized. And then I think they have also given the guideline on how you're supposed to you're supposed to do the content of your portfolio. So you can refer to the ANRO website. And then the pictures is just an example on how I did my e-portfolio. I think a lot of people use this as well. So you just put tabs on your file, a binder file, and then you just put where the evidence is, and then you can just point straight away when they ask you as the evidence for this. So the first bit of the portfolio station is just a tick box exercises to make sure that you have evidence for everything that you score yourself during the application for oral. And of course, make sure that you know everything by heart. This is not the time for you to flip around your portfolio and ask, oh, where is it? No, this is not the time. So make sure you have your tabs ready. Practice it beforehand, like where the certs will be. And the most important thing is, of course, you show your evidence of commitment to the specialty. So after they've done the scoring, they will ask you a few questions, about why you do you want to be an anesthetist, and then they also like to ask you about reflective practice, about learning from your mistakes or learning from your error. So that's the kind of questions that I get during my interview. Um, so yeah, because I have done anesthetics as an F1, so I think that's like a good, you kind of got a good overview on what the specialty will be like. So I found it easier for me to talk to the interviewers what to expect and why do I want to be an anesthetist. So you really have to give a good answer on why do you want to be an anesthetist, just to show that you know what the specialty is about, and show commitment. What you done to show that you are committed to being an anesthetist. I know that the Royal College does a study day for foundation doctors who are interested to be an anesthetist, and I think you do get points for going to the study day, and you can also arrange for a taster session, or go for if you do any anesthetic elective as a medical student as well, so you get marks for that. So basically, just show that you are very interested to this specialty, in some ways. And then the third station is a presentation station. So they will give you a topic. So the time, I think the total time will be 10 minutes, five to prepare. They will put you in a separate room, and they will give you marker pens and paper for you to prepare. And then once the 5 minutes is up, they will call you to the next room to bring your presentation and present to three panels, and then they will ask you questions if you at the end. So make sure that you use the 5 minutes wisely to prepare your ideas, and put it into paper. You can also be creative in writing your presentation. I think there's the marking scheme for this presentation station is very vague. So if you are very creative or very organized in your presentation, you might get extra marks for that. What I can say is for your presentation station, the topics can be quite random. So even if you don't know anything about it, but just try to present something, and then try to break it down. So hopefully, even if you don't know, you can at least say something. So you can divide it into introduction, three main contents, and then conclusion. So that would hopefully give you enough time to present something in 5 minutes to the panel. And of course, you can't always predict the questions, but at least you can always practice presenting to your friends, just to see how you look. Make sure that you don't look nervous. And I think this is also they just want to see how you perform under pressure, because I think in your job you will have to do a lot of things under pressure. People are always watching you, so it's just they just want to see how you work under pressure. And then just the general tips for the interview. Of course, dress conservatively. So always, be on the safe side and dress formally. Be prepared. Check all the documents that you need, especially because we are on a tier 2 visa. Make sure that you have all the documents like your passport or your visa or whatever they need. Be on time. Make sure that you check your time, double, triple check your time and your place. Make sure that it's at the right place and at the right time. And on the interview day itself, there will be lots of people. They will be bringing like super thick portfolios. You will feel intimidated, but don't look at other people's portfolio. Just focus on yourself. You know that you've done enough to get to this day, so don't look at other people. And of course, breathe, and you know that you can do this. So that's the end of my interview tips, and that's the end of my talk. If anyone has any questions. Where is it?
I think we do have a question actually. Some to the main page here. All right. Okay. So we have from Nurbi. What example of evidence of commitment to specialty? Is there anything that's written in the self-assessment criteria, or?
Yes, I think they do give an example of your commitment to specialty. So that includes if you do any foundation year post as in anesthetic or intensive care medicine, or if you go to their, the one I mentioned before, the Royal College does have like a study day for like a career day for foundation doctors. So you get points for that. That's the point I use for my application. You can also you do a taster week in anesthetic, and then I mean, it might be too late for this, but you do get points as well for doing elective in anesthetics as a medical student. But but if you do anything that's related to anesthetic, don't you can always show it to them. The interviewers might be kind to that day and then still give you points, even if it's not in the criteria itself.
Okay. Questions from the audience. I have a couple for you, Dr. Najihah. Is that all right if I fire them away?
Oh yeah, of course.
Okay, right. So I was just wondering, because obviously to become an anesthetic, you have two major pathway. One is direct core, which is what you are on right now, and then there's also the ACCS pathway. For say, for example, a medical student or who's just about to consider this path into truth, say would be the major difference between core, direct core anesthetic and ACCS? What were the maybe top 3 pointers that are different between them?
I would say the difference would be the specialty, because for ACCS you have to do acute medicine and emergency medicine, and you have a longer block in intensive care medicine when you have started your anesthetic years. So that's the main difference. And of course, the extra training year with ACCS compared to core training. And the reason I choose core training instead of ACCS is because I know I want to be anesthetist and I'm not interested in intensive care medicine. So that's why I choose straight away to do core anesthetics instead of going through the ACCS pathway. I think that it is quite commonly asked questions. I think the difference between ACCS and core training, and people do ask whether there is any advantage and disadvantage of doing ACCS. But I think if you are interested in doing intensive care medicine, then going down the ACCS route is is actually quite a good option because it gives you exposure to emergency medicine and acute medicine. And I'm not sure if don't quote me on this, but I've heard people mention that you do get extra point in applying for intensive care posts if you apply for ACCS, if you do ACCS training.
Right. And you mentioned the exam being quite difficult. And I have heard it from a lot of people as well. The exam is, very difficult for anesthetic. Do you know what is the competition ratio to get into anesthetic training itself, despite
Uh,
the difficult exam?
I think it's when I was applying, I think the ratio is 2 to 1. So it's not that bad.
Hmm.
It's competitive.
Okay.
It's still competitive, but not
Okay.
competitive.
All right. So about 50% chance of
Yeah.
of going in.
Yes.
Um, Right. If that's okay, Dr. Najihah, we actually have two follow-up questions from
Okay.
our audience. First one being from Nina, who asked about evidence of commitment to special teachers now. So
Okay.
she was wondering, her portfolio is quite she scores a bit poorly for her it. What other areas can she focus on to enhance her portfolio? Do you
Um,
what would be your advice?
I would say that go for something that you like say for example teaching. I also didn't have any big audit or research in my portfolio, but I did do teaching, and we did actually there was like a group of us who wanted to apply for a job when we were in F2, and we did actually started doing that teaching, to organize that teaching to get extra points in our application. So there's always something that you can do. Speak to your, because I also, because I applied from F2, and I also didn't have a lot of time in my portfolio, so that's why I went through the self-assessment score, and then I see that you get back points if you not only do teaching, if you organize your own teaching. So I went to the undergrad manager in Wrexham, and then just ask her whether there's any opportunity for me to organize any teaching. So the group of us got together and organized our teaching. So we got from that I got an extra point from teaching. So that's always something that you can do. And I think another easy thing is for you to do courses, because you basically just pay to attend courses, and then you can get marks for that. I think you can do like 3 courses, and then you get extra, like you can get full points for that score. So that's always something to consider. And like if you have any regional meeting coming up soon, you can always ask whether you can present anything. So I think the tip is actually just always ask people around, so you never know what opportunities might come up. Because even with my teaching also, it was very I think I got lucky as well that I asked the undergrad manager, and there is actually something I can do to organize teaching at the time.
Right. Okay. So basically, it's trying to focus on other areas of the portfolio, basically like
Yeah.
courses, like you said.
Yeah.
Right. So I think I'll pick the last question, I think, to wrap up tonight's session. So I believe she is probably training in Malaysia or planning to train in Malaysia. So she's asking about, so Sweetie Pie is asking about whether or not this training is recognized. Will you be able to go and practice as anesthetist once you complete your training here in the UK?
Um, yeah, so I did try to contact people in Malaysia about whether or not they accept FRCA, but I didn't get any answer from any of the people that I contacted. So I can't be certain whether or not you can, but I have seen it on the KKM slides, which I cannot find for this talk. But I have seen it that there are one person in Malaysia who actually took the uh, primary FRCA as part of their parallel training programs. So I would say that it is recognized, but I am. But to be honest, I can't be certain. And I did try to find out, but no one got back to me from Malaysia, so I can't say to be honest.
Thank you very much for trying to find out. Okay. So Dr. For those who are planning to go into core anesthetic, do you have any final words to these people?
Well, I would say that
Any
if you
tips or advice?
I would say that if you're interested, then definitely go for it. I think it is a very rewarding specialty. I enjoyed it. I can't see myself doing anything else now. But it is a very demanding specialty. It is busy. You always have to be on top of your portfolio, go to courses, keep on top of your exams, on top of your clinical work. But it is, at the end of the day, it is very rewarding. And if it is something that you like, then go for it. The lifestyle would be difficult. You do have to juggle work and life with that rota, but if you like it, then it's going to be worth it.
All right. Thank you. That's very nicely wrapped up our tonight's session. Thank you very much, Dr. Najihah, for your time, for your effort putting together the presentation, and even contacting a lot of people from Malaysia as well to know whether or not the training is transferable. Inshallah, I hope that tonight's webinar is everyone who's watching. If there is any questions or any further inquiry, Dr. Najihah, would you be happy to be contacted via Ikram about these questions?
Oh yeah, of course. I'm happy for anyone to about the training or about the interview. Just give me a shout. Yeah, or you contact me through Ecom. Yeah,
All
correct.
right, amazing. So that means okay, so that's very amazing. Thank you very much. I'm sure a lot of people out there will be very helpful. We'll be very grateful for your help. All right, thank you so much, Dr. Najihah. Assalamu alaikum. Hope you have a great evening rest.
Oh, thank you. Salam. Thanks, Farah. Dr. Farah.
No worries.